Hey everybody, I'm Dr. Dwayne Whitfield. I am one of the former chief residents of the class of 2020. So I am excited to give you our very first virtual tour of our residency program. So it is my job to give you an inside look of the clinic, the hospital, and everything else above in the residency program. So this is our inpatient room, essentially our conference room, and there are a couple things that happen in here. So right now, as you can see, some of our residents are currently talking to their patients, they're talking to consults. So this is where most of that happens. So this is where things happen where, for example, they're having morning sign out, they'll have table rounds, and then in the afternoon, this is where they'll call their patients, they'll talk to their consults, and then where they'll have afternoon sign out as well. Another really important thing here is when we have our Tuesday morning conferences. So morning conference all the way until lunchtime is where we have all of our lectures. So this is mainly the spot that we have it in, but depending on how many people are attending lectures, we may need to deviate because of COVID-19 precautions and go to a bigger auditorium. All right, so right now we are in Mrs. Susan's office. Hey, Miss Susan, we got to give a virtual hug right now. We're doing a virtual hug. Yeah, nicknamed Mama Sue. So she's been going to my Mama Sue for years and years and years for good reason. So she is our residency coordinator, but also she is our second mom to everybody in the program. So if you have any problems, whether it's academic, it's personal, anything you want to talk about, literally her door is always open, and her email is on our website too if you want to get in contact with her. So right now we are in the family practice clinic, and one major benefit, especially for you applicants, is our family practice clinic is connected to the hospital. So you don't have to take a 10 or 20 minute drive. It doesn't matter what inpatient rotation you're on. It literally takes a couple seconds to a couple minutes to walk over and see your morning or afternoon patients. All right, so the way clinic is set up is we have 2 nursing stations. This is one of them here. We have some of our amazing medical assistants and nurses back here. The patient rooms are all around. We have a couple in the middle, and then also in the center is our preceptor room and then our resident cubicles. So let's go check out the resident cubicles right now. All right, they come in 2 rows. We have one row right here. We have one of our upper levels here, Dr. Harvey. She's waving like she's busy. Yeah, there we go. All right, and then our second row, this is where I used to have my cubicle. We have 2 of our other upper levels, Dr. Breskin, and then our current chief resident, Dr. Moran. Quick wave there. So her and Dr. Bajoli, who's out, I think, seeing patients right now, they're gonna be the ones that you go to for the whole year. They're gonna be the ones that create the rotation schedule for the year, and they're gonna be the ones that hold you down academically, personally, anything you have to talk about, along with Mama Sue, they're gonna be with you as well. All right, so right now we are in the center of clinic, which is our preceptor room. So this is an important area because after you see each patient, whether you're an intern, second year, or third year, you have to present your patients to your preceptor who's assigned for that day. And it's important that you come up with the best plan of care, and you can only do that with your faculty staff members. All right, so there's 2 sections right now. We have Dr. Russ here working hard. So this is the area where we present, and also, and this is also the area where we're able to steal some free coffee, but you didn't hear that from me, all right? So one of your rotations during your intern year is rotating through our emergency department. Our emergency department stays very busy. We have a total of 33 beds with 18 private rooms, and the ability to work one-on-one with these emergency physicians only further is evident that you are going to be feeling like East Jefferson family with every physician here. So whether you're an intern on your night call or your second or third year upper level on your 24-hour call, you got to find some time to get some shut-eye. So what we have here is our call room. There are 2 individual rooms, one for the intern and one for the upper level on call. You also have a personal bathroom with the shower. And one thing that's very, very exciting is the recent graduating class, for their senior gift, donated 2 memory foam mattresses for both rooms. So not only do you get to sleep, you get to sleep in luxury. So on the 9th floor is our rehabilitation center. So this is our inpatient rehab facility, and there are a lot of patients in the hospital that need utilization of this facility. So for example, those who are post-acute, who have suffered some neurological or musculoskeletal diseases, such as a recent fracture, myasthenia gravis, or even a recent stroke, this is where they have the opportunity to get intensive therapy that they need before they're discharged home safely. And then also there are some of those who may just be in our skilled nursing facility and they need a little bit of a milder or moderate therapy. They are also able to use this facility as well. All right, thank you for joining us on our virtual tour. I hope you guys really had a good experience or were able to see a lot of things we had to offer in the hospital and clinic, in our program in general. Look, I came from Ohio, so I understand coming from a different state, you know, you want to make sure that you feel right at home. And I guarantee 100% on my first day, they made me feel like family. And I know they can do the same for you. So if you have any questions, comments, concerns, please get in touch with Mrs. Susan Perrier, who is our residency coordinator, or Dr. Lisa Casey, our current program director. All their information is available on our website. Thank you.